I think we're all here very excited to have our science advisory team as part of this conversation and discussion today. Welcome, and we'll get to introductions here in just a moment, and then start going through some of the questions that have come our way. But it's great to see everybody this morning. Again, to everyone, this team, our science advisory team, meets on a weekly basis, and what we do is we look at data. We look at the spread, data that's related to the spread of COVID in our community and in our school system, and ultimately what its impact is on the decisions that we make in our school district and the level to which we have students attending school in person. And so it's incredible to have these brains at the table talking about all the new learning that's happening with regard to COVID and its impact on all of us, and how we can make the best decisions that support academics in our schools, academic, social, and emotional learning and growth, while also keeping people healthy. And this team has been a huge asset to making decisions in our district. So what I'll do first of all is just start off with some brief introductions of the group. And so on this team, we have our board president, Jeannie Zoller. We have our district nurse, Nicole Murphy. Nicole, give a quick wave. There you go. Very good. Our director of communications, Susie Hankey. And then before I introduce our doctors, I just want to give them both a big shout out. We appreciate the time that you provide to us. We know you're incredibly busy, especially during this time. So we very much appreciate you giving us your time on a weekly basis. That cannot be an easy thing to do. And I know you have meetings before you get to us. You have meetings way after you come to us. You're both parents of Wyoming students, so we appreciate the knowledge base you have of our students and their experience in the Wyoming community. And you're both experts in the field of the ever-changing field of COVID and its impact on people. And so, again, we couldn't do what we do without your knowledge base and the research that you bring to the table. So welcome to Dr. Kathy Auger and Dr. Robert Kahn. We appreciate you being part of this conversation. And I also will say we always have a representative from Hamilton County Public Health. Chalia Hamilton has been with us every week. She's not with us today, but she's always part of the conversation. So what the plan for this morning to do is to answer our science advisory team. Certain members of the science advisory team would answer some of the questions that have either come from us as board members or come to board members through community members, just about COVID and different things that are happening in the district, different ways in which we make decisions. So I think what we'll do is we'll have Susie share those questions, and different members of the team are going to respond to each one of those questions. And we can elaborate on that if there are other questions that come from those, but just a great opportunity to get a sense of what this team does. And again, I appreciate all of the individuals who are part of that weekly conversation because it makes a difference, a huge difference, and a huge impact on our students and our staff. So thank you. All right, so I'll turn it over to Susie.
Okay, so I've taken the questions that board members submitted. Thank you for those. I've grouped them because there was some overlap a little bit. So I've kind of grouped them, but I've tried to change the wording just as little as possible. So the first two questions kind of fall under other schools in my mind. So there's a couple questions here. So I'll just read both of them. And then if we could move forward with answering that would be great. So one of our board members said, I'd like to know some of the implications that other like districts are experiencing, sharing literal examples to highlight the unplanned disruption this is causing their districts and parents. So we don't remain in this overly simplistic place of they're open 5 days and it's working fine, but we can't do it because we're scared. So people see the impact others are experiencing, and people see that we weigh our consistent design against reality in other districts. And I think the other question that we got that seemed similar to that was, it's hard to see like schools going 5 days a week with seemingly little consequence. In the face of this, how does the team justify the hybrid approach versus 5 days with other layers of mitigation?
So I had some initial thoughts on that question, and feel free, anyone from the team, to continue on some of this. I would say that it's first important to point out that when we designed our plan, we designed it in a way that it would adjust to the levels of COVID in our community. And again, as we've shared, that as the level of COVID increases in our community, our plan is designed to limit the exposure of students. And one way to do that is to go into a hybrid model where there are less students coming into the school buildings and into the classrooms on a daily basis. And so what that does is it allows us to increase the social distancing in every classroom. So it's a proactive measure. It's meant to be ahead of the curve and keep our students and our staff safe while still offering a face-to-face instructional program. You know, as we look back to what happened during the first semester, I would say that we feel as though our plan has been successful in continuing to allow in-person instruction, but also minimize the number of positive cases that we've had and the need to quarantine. We know that that's happened and students have experienced that, but it's very different from what many other districts have experienced. So on the flip side of that, as we continue to, you know, even when we talk in our science advisory team, we talk about the research. We also talk about the school experience that we see in our region from other school districts. And so as we monitor other schools, especially schools that have been in 5 days a week, we've seen over the course of time, over the last 4 to 6 weeks, especially, some of those negative consequences that they are experiencing. And so what we've seen is very high numbers of positive cases in many other districts, very high numbers of students being in quarantine, and ultimately their need to modify their plan and change their plan and move from a 5-day-a-week experience to a hybrid experience, or in many cases to a full remote experience. And so that's really what we've seen a lot of in the last 2 to 3 weeks. So they are experiencing some of those negative consequences of what I think is probably students that are in close proximity together in a 5-day plan. And all of those consequences impact students, they impact staff members, they impact families in many different ways. And so, you know, looking back, that's one of the major reasons. It is the major reason that we created a plan that proactively tried to stay ahead of that rather than be reactive to COVID levels in our school system that unfortunately would create cases and quarantines for kids.
Okay, the next question is related to our COVID questions at wyomingcityschools.org email address. So this question is, are all questions being sent through email to COVID questions at wyomingcityschools.org being answered?
Yeah, I'll get that too. I've had that question a few times. In that video series, we are using that to answer the most frequently asked questions. So unfortunately, we're not able to address all of those questions through that video series. And this somewhat goes back to Heather's question. You know, when there are very specific questions, I would really encourage people to reach out to building administrators, reach out to classroom teachers, counselors, those individuals who can really help support the unique needs that students have. Those are the best individuals to reach out to first to address some of those questions that are really, again, unique and particular to student needs. But on that video series, again, we'll continue to address those questions that come in most often, so that we can respond to what many in the community are wondering about.
Okay, the next one is about the path back to 5 days. So given that we have changed our metrics and the goal is to get to 5 days, what are some of the key local metrics you will be watching to justify the transition back to 5 days?
I can start out. Again, thank you all for what you do for our kids every day. And I just want to emphasize our perspective is really just focused on the COVID, and obviously in making decisions about getting back to 5 days, it's a balance of what's happening with COVID, what's happening with the quality of learning, what's happening with the social emotional well-being of the kids. So bring in the COVID epidemiology lens. I think the framework, the city health department and the county health department, Cincinnati Children's and the Health Collaborative put together about 3 months ago is still the right frame for figuring out how to get back to 5 days. And it was different than what we were looking at over the summer, right? When we were looking at the summer, it was strictly about the prediction was what's going on in the community. The frame then moved to, well, now we're accumulating school-based experience. First and foremost should be, is there evidence of in-school transmission? Is there evidence of a widening ripple of quarantines? So even if there's not so many cases, are there so many additional exposures, that we're missing high absenteeism? And then what's the impact on staffing, both cases, quarantine, and absenteeism? So that is the first frame. And then the really just correlated prediction is, as community rates rise and drop, what's the impact on those primary set of measures, right? So then if you said, well, how will we know it's okay to go back to 5 days? I think it's that same framework. How many cases are being caused by being in school? And then how many cases are generating quarantines, whether they're in school or community-based? So to me, if you're looking ahead after January, as an example, like, what is the impact of Thanksgiving and then the school holidays on the community rates? And how is that rippling in terms of student and teacher cases? I think we've seen relatively little evidence, district, county-wide, for in-school transmission. So that's been reassuring. And I think nationally, like, the disasters that people thought might happen have not happened. That being said, very reasonable for others to push back and say the only way to know that for sure would be to test all kids, all staff, all the time. And how do we know we're not generating asymptomatic infections that are coming back out and infecting a grandparent? I'd say nationally, there's evidence perhaps for a very modest impact of that, but it's something we can't rule out. So Kathy, you want to chime in anything on there? I think, back up, like, what's happening in the school, and then the prediction factor of what's happening in the community. Sorry, Kathy. Other piece I'll just add that you may have started to hear is, what is public health evolving in terms of the lengths of the quarantines and the potential to, will it ever be okay to be at less than 6 feet? I think those are both modifying factors to trying to get kids back in school 5 days a week. And I'd say for both of those, they're evolving as we speak. Kathy?
I would just reiterate that, Rob. I think the district has done a really phenomenal job sort of outlining the plan and having different, a very clear sort of pathway for when are we going to consider hybrid, when are we going to consider online, when are we going to consider fully in person. And it is, all of that has been driven based on the best evidence for keeping kids in school and keeping schools open, because I think that's the goal, is to have as many in-person learners as we possibly can. But that evidence obviously is still evolving. And so I think one thing that's been really awesome about this process with the Wyoming City School Board is the ability to reevaluate and sort of and get the new evidence and make adjustments as new evidence becomes available. And that is something that I think Dr. Khan and I are both committed to, is trying to understand what that evidence is and try to bring that lens to the table as well.
Okay, we'll move forward with the next three questions are about sports. So the first one being, why sports and not everyday school? Does the team help make decisions on sports participation?
Okay, I will speak to the sports questions, and I know we don't typically have our athletic director as part of the conversation too, so that's a luxury today. So Jan, feel free to elaborate on any of these also. But in looking at this question, it's a great question. It often gets asked, and so one of the things I think is important to keep in mind is that sports operate, when you think about, well, and it's not just athletics. It could be theater, it could be band, it could be color guard. Smaller groups of students operate much like a special cohort does in a school. It's a smaller group of students. The students are always the same, And the structure in which they meet is always the same. They meet in the same environment every day. So again, operates much like a small cohort, maybe like a primary classroom, like cohort does. They don't see different types of people, different coaches, different teachers on a daily basis. And also in athletics, there's not a hybrid option. In athletics, we can't compete in a hybrid option, so we wouldn't be able to move in that direction if we wanted to. But like school, there are multiple layers of protection that are taken within athletics to be proactive to prevent cases from occurring and quarantines from occurring, at least to the best of our ability. An example of that is we're not using lockers, because lockers would pull students close together and they'd be in close proximity. So we're not using lockers. We're cleaning equipment daily. We're setting consistent routines up for all of our athletic programs that are mindful of all the other strategies that are happening throughout our district. And I think the other piece to understand is, when we think about this, we know that these activities, these extracurricular activities, are part of the critical social and emotional connections that many of our students have within our district. And so we're trying very hard to keep those in a way that to monitor those in a way that they can continue. And we handle those on a team-by-team basis. Again, hope to have those continue because of the great opportunity they offer for our students. Jan, I don't know if there's anything you would add to that.
I think the critical piece of it is the teams truly do operate different than in a classroom. They're not changing bells every 48 minutes. They're truly in a group. I think you used the term cohort. I think that's a great example. And again, protocols are in place, and there is no hybrid option. If we could practice every other day, that would be great, but that's not an option.
Jan, I'm just watching the newspapers. There are a number of CHL schools that have pulled their sports program for the winter. At a certain point, do we do that as well because we've run out of people to compete with, or?
We're never going to run out of people to compete with. We're going to play whoever's willing to play. We might be 0 in the season, but no. I think that's a great point, Jeannie. I think when you look at what other schools are doing, certainly that has to be a metric. Unfortunately, a lot of those schools have publicly said things like their students and coaches wouldn't follow consistent protocols, and therefore they didn't feel like the environment was safe. Some of the schools were in session every day and we're heck bent on we're going to be in session every day, and the result of that is massive quarantine shutdowns, and therefore they're unable to field enough kids to participate. So I think the approach we're taking is sound. I think it's solid in that we're going to shut down as things become an issue. But if there's no cases on the swimming team, we're not going to shut down the swim team because wrestling has a concern or a spread of cases. We're going to take it piece by piece and try to keep student athletes engaged. It was Saturday night was a little piece of normalcy at Wyoming High School. We had a play going on in socially distant crowd, which was amazing. And we had a basketball game going on with very limited spectators. So for the first time, 2 events, no parking issues, but a little piece of just a little piece of normalcy for high school student athletes at a time that they don't have a lot of that.
I think we've got one more question in the area of sports. Governor DeWine has urged the Ohio High School Athletic Association to not have fans attend indoor sports, and they're managing the total number of spectators in attendance to enable distancing and requiring masks. What is our plan in this area?
Yeah, so Jan and I have spoken about this, and Jan, again, extend onto anything that you'd like here. So the OHSAA has shared that if we're able to have fans, but if we are going to have fans, the recommendation is for those fans to obviously be our parents. And so within our plan, we've incorporated that thinking into our plan. So currently we permit 2 family members per student athlete at home basketball. And we have no spectators at swimming or bowling, and that's because of the facilities for both of those locations really don't allow for that. For wrestling, we will not have fans coming to home wrestling meets. And the team has really set up a great protocol for when there are multiple games. And so the gym is cleaned after every game, or the gym is cleared and cleaned after every game. So really at any time, there's only 80 individuals in the gym for any game. And fans don't come into the next game into the gym before we clear out the entire gym. And so it's this incredible process, very difficult, labor-intensive process of clearing everyone out, cleaning the entire facility, and then letting everyone in. And before, I was there Saturday, so I witnessed that exchange. And so our families for the next game come into the cafeteria, and so they're able to spread out in the cafeteria. As the current game fans are cleared away, then we allow those other ones to come in as soon as the gymnasium is cleaned and ready to go. Great process. Jan, anything else that you would add to that?
I think it's important to note, the risk is always bringing two communities together. I think. I mean, I'm sure the science team will support that possibly, but I think the risk is always bringing two communities together. So what we've done, again, to be intentional is we put the visiting fans in one section, the home fans in another section, all socially distant. Seats are marked. Basically, our rule is if you don't live with them, don't sit by them. And we sanitize everything after every game. So after every freshman game, before we let the JV parents in from each community, we go clean the gym. When we're done cleaning the gym, we go back and clean the cafeteria where they're coming from. So it is a massive effort to do it, but we'll do what we need to do.
Okay, the remainder of the questions, I think, all fall under the idea of the science of COVID. So the first one is, given all the various childcare options that have to be put in play, is hybrid really safer?
Sure, I can take a first go at that. I think it's a really great question. And I think it's one that people struggle with a little bit because what's happening when your kids are at school. You know that they are being physically distanced, and yet you don't know what's happening with other children in the community on the days that they are remote learning. And so you have to wonder, are families being as safe as possible? Are our kids being as safe as possible? And there are a couple of points to make on this and why we think that hybrid is the safer option. So the first is when you're in a hybrid situation, you can have the full physical distancing in the classroom, right? So you can have 6 feet between all of the kids. When you go away from the hybrid and go back to 5 days, you no longer have the luxury to have that extra space. And we know that space is important both in terms of transmission, but it's also important in terms of quarantining. So when there's a case in the classroom, which when our community numbers are high, we know that there are going to be cases in the classroom. When there's a case in the classroom and you're in a hybrid model, many fewer individuals, whether they're students or teachers, have to be quarantined. And that is that's important for keeping kids in the classroom as well. So that brings to the second point is, your other sort of childcare or arrangements that happen when you're not in the classroom. So we hope that a hybrid model allows for some stability in that, right? So parents know what to expect. They know what days their kids will be in school. They know what days their kids will be out of school, and they can make arrangements that are as safe as they possibly can because it's a known schedule. When you start bringing everyone back 5 days and you have kids sitting close to each other, when you have a case, whether, especially when you're talking about when you're rotating classes every 48 minutes, right? You have one case and suddenly everyone sitting next to that person in all of their classrooms has to be quarantined. So the number of quarantines goes up, and then that leaves families who have children that are quarantined really scrambling for childcare options. And we are concerned that when you're scrambling for last minute childcare options, that you're not going to have the same ability to have the same safety that you would if it was a sort of a scheduled childcare need. And then a third point is There is some moderately good evidence, particularly back from the spring when classes and schools were open all the time, sort of in the prior to masks and the prior to having physical distancing, that closing schools was an effective way to calm down the coronavirus pandemic. And so there probably is a connection, even with all of our masks and our physical distancing, between having schools open and overall community rates. So by being able to do all of the safety procedures, by increasing your physical distancing, we're actually probably helping keep community rates as low. And then the final point that I'll make is, again, that we at Cincinnati Children's, several researchers at Cincinnati Children's are trying to understand the science of that. And we're looking at the greater Cincinnati data to try and understand, is there a way to be just as safe at 5 feet as you are at 6 feet? And as soon as we have more information on that, that is something we also want to incorporate in. But for the time being, with the information we know, that's why we think that the hybrid plan is a safer model than the 5-day week when the community numbers are this high.
The next one is, are some mitigations better than others? For instance, do we still need to keep washing surfaces between classes even though we have masks and shields? Is there more comprehensive research on how this disease is spread?
So great question. I'll lead on that and others can chime in. Bottom line is we can and should still do the whole bundle, right? The science and essentially the reliability and engineering required has been proven again and again that if you want to keep the community spread from turning into school spread and quarantine, do it all. Now, that doesn't mean they're all exactly weighted. Certainly the masking and the spacing are really critical as we find more and more about airborne spread. I've seen no articles anywhere that said we don't need to do surface cleaning anymore. The metaphor that comes out of industry and the hospitals have used is the equivalent of Swiss cheese, right? The odds virus will get through if you only do 1 or 2 of them are much greater than if you put them all together, right? So you can put your finger through a single slice of Swiss cheese. If you do a large block, there's no way to slip anything through. So I think what Wyoming has been extraordinary about, and I get informal reporting from my 17-year-old, is its ability to do all of them reliably. And the best way to keep kids in the seats and keep the sports teams going is to do that not just at school, but at home. So continuing to do the full protective bundle, I think, is important. And thinking, if you had a parts per 100 fail, if 90% of people or 99% of people mask, 99% of people space, 99% of people do the hygiene, you're still going to have a failure rate, but that goes way up if we drop to 90% or we drop to 80%, like 0.8 times 0.8 times 0.8, you're suddenly raising the level of infection that will slip through. So doing it all, doing it with high reliability at school and at home is the best way to ensure kids can be in seats playing sports and theater.
Okay, I think the next couple questions are around the science of COVID in younger students. So are younger children less likely to contract and spread COVID-19? Do they carry antibodies similar to those needed to fight off COVID? Are they asymptomatic? And lastly, is all the available COVID research, the vaccines and treatments, they not specifically designed or tested or peer-reviewed for children, therefore not reliable?
There's a lot in that question. I think we do believe that younger children are more likely to be asymptomatic or more likely to have mild disease where they just maybe have a runny nose and not some of the more severe life-threatening conditions. So, we are still just learning so much about this virus. I mean, just a month ago, there was some studies about kids living with people who had COVID, so within the same house, and they were able to test the children regularly and they never had the virus, but then they had the antibodies. So there's like these things that happen that we really are just learning and trying to understand how this could possibly be occurring. So, you know, I think there's still a lot more that needs to be done in terms of understanding the science. And that's particularly true when you talk about vaccine development. So there are only a handful of places in the country that are testing vaccine in teenagers from 12 and up. There was really no tests so far on under 12. So I think there's a lot more that we have to do and understand in this population. Rob, I don't know if there's anything you want to add.
No, we shared with Susie a link to one of our vaccine leaders at the hospital giving a brief 15-minute presentation on vaccines and what's coming. He's leading one of the 5 sites for one of the vaccines for youth testing. So Susie, maybe we can make sure that gets posted somewhere for folks to get the latest on the vaccines as applied to youth.
I think if I could just speak quickly there too, we kind of cited a couple examples there of what is so exciting about the makeup of this team. I mean, we have access to this information as it is evolving. So we both know that it's even out there. And second, we're participating in it also. So we're involved with the research and the data gathering about in-school transmission by age of student and all of that. So, so I really appreciate what the doctors bring to the team. So the next 2 bullets are kind of, I've grouped them about like following the research. So it appears there's a couple here that are related. It appears to me that there are many articles out there on the relative safety of primary and elementary schools, but those are not actually scientific studies. They are reviews of reported cases from school districts, counties, and states over time. Many of them do not take into account transmission to teachers and parents of from asymptomatic students, and I wonder about their reliability. I also wonder if the team has a broader sense of what is happening outside of our like school districts. And kind of on a related question, how can parents follow the research and the data? Is there a source for staying informed?
I'll start, and Kathy, please join in. I think underneath it all those prompts is, how can we know what we should be doing? Are there quality studies out there that are providing definitive answers? And I agree with the premise behind the question, no, right? There's no districts randomizing approaches to 3 feet spaces versus 6 feet spacing, or hybrid versus remote, nor do I think there's good science that's trying to solve for multiple outcomes at once, because you could get to 0 risk for COVID, but what are we doing about mental health, and what are we doing about the quality of the learning? And so inevitably folks are frustrated, right? Who's balancing all 3 outcomes in a quality way? What isn't helpful, and what is the farthest from the science, are clickbait headlines, right? Israeli school district ends up with 250 infected, right? And all it does is generate fear. And so I think what I would say is, that the framework you've developed for deciding whether to go back to school, apply that to every article you happen to look at, whether it's in the newspaper or magazine. Like when they say there's cases and staff absences, what's underneath it? Was it due to being in school? Can you tell, was there in-school transmission? Is it due to cases, quarantine, or staff needing to take care of other family members who are sick? Or is it due, like in Chicago, they started closing districts in New York for a while on the percent positive? Well, how relevant is that to the way we've approached things? So bring that sort of more rigorous eye to what you're reading, and when family members or community members bring you things, is try to bring that disciplined framework and take some of the emotion out of it. And then ask, how do we balance that against the other important outcomes, right? Because we'd all like to have 0 risk of COVID. On the other hand, I think it'd be fair to say on any given day in the hospital, we have far more kids hospitalized for mental illness or other causes than we have for COVID. So isolating COVID, which can be measurable with a test, sometimes misses the point which we need to solve for several things at once. I think there are a few good sources. They don't all keep up equally. So the CDC seems to be moving to be more adaptive and real time these days with more updates on science. The Johns Hopkins site, many of you are probably aware of, they do have a group that's looked at some school work. Children's Hospital of Philadelphia similarly has a policy shop that's been putting out reasonably good science on COVID as well. Kathy, anything to add to that?
Yeah, no, I do think that one point about, you hear about low cases in students in elementary schools and some of the newspaper articles. I think that's interesting. I have the same concerns though about what are the staff cases that are happening, and that is one of the main research questions that we're looking at in the greater Cincinnati area data is that elementary versus middle versus high. And we will continue to gather that data, but so far we aren't seeing this like, oh, the elementary school has the lowest amount and then the middle and then the high. And I think it's actually largely because we're also including staff and not just student cases. So, but that is something that we really want to understand as quickly as possible. And so I don't know what exactly people think of when they think of like school districts. I think what Rob and I are trying to think about is sort of the greater Cincinnati area.
So we just got a couple more. This one is more general. Forecast, if possible, the next few months as we all move inside. What might we expect?
I'll start. There is no great crystal ball, right? Pretty much all forecasting since the beginning hasn't been so wonderful. I think it's a series of what's the probability to different scenarios, and so. I think the question is what's going to drive a good scenario versus a bad scenario, and in some sense you're all just as expert as we are because it's so dependent on human behavior, right? What are the odds we'll be driven by fatigue and drop that reliability at home over the holidays versus have some hope and optimism being driven by coming vaccines and others that we can last. I think it is very reasonable to assign the greatest probability is for the first week or two after the holiday, we're not going to be in great shape, right? There's just going to be just enough mixing, no matter what, even if we try to mostly be good, that the community rates are not going to be that dramatically different than they are right now. That being said, that's a range of probabilities. Right now, we're at probably 72 or 73 per 100,000. In the county, and odds are we're going to be above 50 through the first couple of weeks of January. I think other factors consider what will be the influence of flu on top of that. I don't know, Kathy, other factors that could influence whether we're more set to come back in force or have more risk.
No, I think that's exactly it, Rob. I think the holidays even are going to be, sort of a telling point for us, and hopefully as we get through that time period and into January, people can rally the strength to continue with their seriousness about social distancing, even as you hear about vaccines being developed.
I would just add one other factor that I know the hospitals are trying to do a better job of, which is bring you inside to know what's happening in the hospitals and just how close to the edge we are in terms of capacity, in terms of available beds and available ICU in particular. And I'll say Children's Hospital has started taking overflow from University Hospital for young adults 20 to 30. So that's never happened before, right? That UC is transferring folks to Children's Hospital. So those headlines in terms of battling the fatigue is then the fear. Will I not be, my mother won't be able to get her elective procedure. If she were to get sick, will there be enough ICU beds? So I think we'll see how that goes through the holidays, whether that can keep enough of us maintaining our masks and cohorting and potting and distancing.
And then the last question, it's a little more looking predicting the future further into the future. But what goals should we set for returning all kids in person and all online learners to in person? And how will we measure successfully reaching those goals?
Yeah. I mean, I think this is like what everybody wants, right? This is what we all are striving for, and what hopefully keeps us going, that this is going to happen again someday. And it will, right? But I think, as we've already discussed, there's still quite a bit of things that have to happen. We have to get our hospital volumes down. We have to get our community rates down. We have to sort of get this pandemic back in check. And, there are vaccines coming. And, I'm hopeful that some of the staff teachers and staff in schools will be considered priority individuals and will be able to be vaccinated sooner. But I do think that pediatric vaccination is going to be a longer time frame. So lots of reason to be optimistic, but also realistic in that we're still going to need to be wearing our masks and do our physical distancing for a while still.
I'll just quickly add, I am increasingly hopeful of a return to normalcy. That being said, given the space constraints and the requirement to be at less than 6 feet to get everyone back for 5 days a week, I think it will be hard unless the CDC or others do good science to say, 5 and 4 feet are safe. And until then, getting back for 5 days a week will get you some short-term gain, but lead to more quarantining, right? You'll get back in there, but as we talked about earlier, if you try to do that too soon, and public health will say you got to quarantine anyone within 6 feet, you may get to five days a week for a little while, but then with the community pressure, you'll end up with community-acquired cases and a ripple effect of quarantine on your staff and your kids. So there's nothing I want more than get my 17-year-old back in school 5 days a week, but I do realize you push too hard too soon, you'll end up with short-term gain and long-term absenteeism from quarantine. So
that's all the questions.
I'll just go back to emphasizing, I'm sorry, Susie, this is like the COVID perspective. There are multiple outcomes you're balancing for, including the quality of learning for younger kids, especially remote. So we're just bringing the science side, and as a board and as a community, trying to balance all of those factors together.
Susie, I just have been burning to ask Kathy, is that Himeji Castle in your background, or which one of those?
It is actually nice landmark recognition. We were there last summer.
I celebrated a sakura there once in 2008. So
Kathy always has great backgrounds. Every week, it's like a little trip.
Yes.
I want to thank all of you for not being a part of the science advisory team. I know that I have faith in all of you, and I feel like when I'm trying to represent what you're doing out in the community to the best possible, it's hard because I don't know everything that you do. So it's very helpful for me to just hear your words, and hopefully that this is recorded, that the community can review this, and it's thorough. And I just want to reiterate it. So we would all love everybody back. So to really hear the science of it and the why we get there, and it's not easy to make the decision to not send the kids back, but to be safe. And I love what you said, Dr. Khan, just the short-term gains for, like, what does that look like? So I just appreciate you taking the time for every week, honestly, but today to do this during our meeting is very helpful. Thank you.
You're welcome.
Yeah, I also want to connect too and share my appreciation for recognizing the mental health component here too, and to know that that's part of the equation and part of the balance. But it's that delicate balance of keeping that in mind, but not pushing so hard that we lose track of that in the end if we had to go to a full remote situation. And just, again, recognizing that is a very big component that we factor into the conversations. Definitely a big piece of that. And I just want to say thanks again. This science advisory team is, as you can see, incredible. And so to have these weekly conversations is such a benefit to our school district, to the kids, to our students, to our families. Just amazing. And so I appreciate everyone's availability and willingness to be part of this team. Thank you.
And I say to Nicole, thank you for, to do with all the schools in our, to take care, to manage this for any district nurse in any of it. Kudos to you. I'm sure that has to be lots of sleepless nights. So thanks for, it's like a lot to balance. So thank you.
Thank you for that. I appreciate it. It's been an interesting second year as a school nurse. So, but great people to work with. And just to talk a little bit about what Dr. Khan said about, if we did go, he mentioned this before, if we did go full time, face to face, how quickly we would be all remote. I mean, being here in the school and having done some of the contact tracing situations, I can tell you that, when we've had to quarantine one or two, if we had been full face to face, we would have had to quarantine, double, triple that amount. So I think we're doing the right thing for our students to keep them in school, as much as we can.
Well, I guess just to know that that's always developing. And like you guys said, all we can do is make the decision based on the science that we have at this moment. And so that when that changes, that we're willing to be flexible and adapt so that we can get there. And I know it's frustrating because what people would love, as we would all love, is to say like January 6th, we are 5 days. And the fact that we're not doing that so that we can look at how we're adhering to it and not getting fatigued, because it is easy, right? That we just, if we could hold on to hope and optimism, Dr. Khan, I liked that you said that, get there, a few more weeks so that we can, it's hard. So appreciate it.
Are there any other questions or comments? Because I don't want to leave anybody out, please. All right, I thank you all. Certainly the doctors are offering us immeasurable information that is helping to make our decisions. But as a board, I thank all of you as well for, we're doing our very, very best. And we thank the work that our administrators are doing with Tim in the lead. And we're going to try. I mean, I think as Dr. Khan put it out there, there is no definitive textbook that we can follow chapter by chapter. Information is happening all the time. I know I looked at that newspaper report just this week about children's expanding to age 30 so that they could help out university, and I was amazed. So, we'll do we've got to remain flexible. I know some of the other school districts are using words like being agile and being resilient, and we're right in there with everyone in terms of what we're trying to do here to do the best thing for our kids and our staff. So
I have one last thing.
Please, someone needs to finish it up. I think it's time for Elia's wonderful statements, please.
What I found helpful, and I said several people sent it to me as well, and DeWine sent it, but it was from December 3rd, but to look at the percentages across the state of Ohio that almost 45% of students were full remote as of December 3rd, and that yes, there's people in person, but there's also such a variance, and that almost 700,000 students in the state of Ohio don't have the opportunity to even be in person, that it's an ongoing balance of how we can get them all back there, but safely. That was helpful to me just to see the numbers, because it is easy for us for me to get stuck in our everyday and our four walls and what's happening just here, and not always the bigger picture.
Right.
Try to stop. I know you have lots of meetings, everyone. Thank you.
All right, if there are no other comments, then we are at the end of our meeting, and I will ask for a motion to adjourn, but once more I'll ask, I don't want to turn anybody off. Is there anybody who wants? All right, then may I have a motion to adjourn?